Good afternoon, everyone, and welcome to DAPS 2.0, CDC's 2018 Diabetes Prevention Recognition Standards. I'd like to welcome you all today to our webinar. It's nice to see many of you again virtually. You're such a part of the work that we do here in our Diabetes Prevention Program team. We've met many of you through our cooperative agreements with the Centers for Disease Control and Prevention, others we've engaged with at state engagement meetings, and still others we've met through our lifestyle coach trainings, our Building Your DPP workshops, our workforce training, and other opportunities. And I know that many of you are among our 14,000 members across the country, nurses and physical therapists and pharmacists and dietitians and other diabetes educators that are out there making positive changes happen. My name is Angela Forfia. I'm the Senior Manager of Prevention for AADE, but it is not just me here today. I'm going to be doing a lot of the talking through the webinar, but the whole DPP team is here. These are some ussies and selfies we took yesterday and today. So we have our Program Manager, Natalie Blum, our Evaluator, Patrick McMahon, our Program Coordinators, Erin Horetsky and Jasmine Burleson. And then we also have our IT and legal team who are making sure that we are doing everything according to HIPAA standards, ensuring data privacy, keeping us up to date with technology. We have our leadership team, and of course we have our DAPS developers. So there's a whole team that's supporting you. Just a couple housekeeping things before we run through the agenda. Just to make sure that we have the best sound quality for our webinar today, please take a moment to mute your line. You can do that the old-fashioned way using the mute function on your phone, or you can do that over in the control pane by making sure that the little phone next to your name is red and it has an X through it, or the little microphone is red and has an X through it. However you want to mute us, kind of keep your line muted so we can keep our sound quality the best for everyone. We are recording this webinar today, so just to be aware that this webinar is being recorded. So if you do need to take a break from the webinar, please do not put us on hold, because then we will all potentially be hearing your hold music. We will be sending out that recording. We'll be sending out these slides. If you have questions during the webinar, please feel free to enter them in the chat box. That's also in that control panel that's over on the right-hand side of your screen. We'll be answering all the questions that we can today. Any that we don't get to today, we can follow up with you about, or you can always email us. So with that, let's go ahead and get started and talk a little bit about why we're here today. So the first thing that we're going to do is walk through rather quickly and at a high level CDC's 2018 Diabetes Prevention and Recognition Standards and Operating Procedures. That's a mouthful, so I'm going to be calling them the DPRP standards for short. We're especially going to be talking about those standards as they impact participant and session data within DAPS. And for those of you who already have data in DAPS, which I know is many of you on the phone, your data has been converted to align with the 2018 standards and with the 2018 data dictionary. So we will be kind of talking about how that existing data has been converted. Of course, kind of where the rubber hits the road when it comes to the national DPP is in the analytics. You want to make sure that your organization is on track to achieve preliminary or full recognition, or to maintain that recognition. And so all of our analytics for DAPS 2.0 are now aligned with CDC's 2018 DPRP standards. We're going to be showing you exactly how you can add, edit, import, and export data. And we're going to be giving a little sneak peek of some enhancements that are coming to DAPS in the next quarter around Medicare DPP. So let's start very high level with what's changed for 2018. As you know, the first step to joining the national DPP is applying to CDC and receiving a DPRP code or organization code. For 2015, there was a lot of flexibility in how you could offer the program under that code. CDC for 2018 has moved to a one mode, one code system. We'll talk a little bit about that on the next slide. There is a higher BMI threshold for participants, so they're looking for individuals within the general population to have a BMI equal to or greater than 25. And for those who are Asian American Pacific Islanders, they should have a BMI that's equal to or greater than 23. Previously, under the 2015 standards, there was a limit of 50% of your group that could come into your group under a positive risk assessment. That's the paper form that's available from either CDC or ADA that allows people, to count on their fingers or to add up their numbers and see if they're on paper at risk for prediabetes. CDC has changed that. So now up to 65% can enter based on that paper risk assessment. There's some additional data elements both for participants and sessions, and there's more frequent data submissions to CDC. So they are going to be looking for your data every 6 months after you register for that pending recognition status. So let's take a look at what that means for your organization. And let's start with that one mode, one code policy. So as I mentioned before, CDC had been very flexible in terms of allowing organizations to offer the program in multiple modalities under the same code. Now they are really connecting one delivery method per code. So if you have an organization DPRP code, you can deliver in person, you can deliver online, you can deliver through distance learning. Example of that would be telehealth. Or for the greatest flexibility, you can register as a combination site. Again, that is going to have an implication for our DAPS subscribers. DAPS is really connected to that CDC DPRP code. So it's one mode, one code, one DAPS subscription. Again, you can register as combination for the greatest flexibility. If you are a site that has structured programs that are going to be offered in person, through distance learning, or even through online, and you're utilizing DAPS, you can transition so that each of those organization codes is connected to a different subscription. So please contact us to find out more about that. So what do all of these changes mean for DAPS 2.0? Well, DAPS is now, and as of 1 July, compliant with CDC's 2018 DPRP standards. We've added all of these new data elements. The existing data in the system has been converted according to the 2018 data dictionary, and new analytics have been added for participants, cohorts, sites, and organizations. So here are the new data elements, and there are new data elements for participants, and there are new data elements for sessions. For participants, the new data elements are enrollment source, payer type, and education. There's also additional nuance in the race, ethnicity categories, and there's new coding and valid values for existing data elements. Similarly, with sessions, you are now asked to report delivery mode per session. So again, your organization has a modality, so you can say, oh, we're an in-person organization. We deliver, the vast majority of our programming in person, but it allows you to identify how each particular session was delivered. So maybe there is a random session that is delivered by phone because you had a big snowstorm. We deal with that here in Chicago. Or there was a makeup session that was delivered in a different modality. CDC is also asking for a new way of coding each session through a numeric code and asking you to identify the session type. So that's core maintenance, and ongoing maintenance. We're going to talk through all of these in different slides, but these are just the high-level changes that we're seeing in the data elements. So let's take a look at a participant file or participant chart. I'll say just at the outset that Erin, as you may recall, is one of our team members here. So this is data that we're using from our testing site, and this is not EPHI about Erin. So on this participant chart, you're going to see these new or more nuanced areas where we have education level, ethnicity details, and race. And I'm just going to talk through what that looks like in terms of how that data is coded. So what CDC is saying now is with ethnicity, you're going to first choose Hispanic or Latino, which is one kind of means yes here, or not Hispanic or Latino, which is 2. Not reported, the default is 9. So I'm not going to get in the weeds too much on the data dictionary, but I did want to show on this slide how these are kind of like yes, no toggles for these categories. So you're either saying like Hispanic or Latino, yes, not Hispanic or Latino. And the same kind of structure is available for race, where you're going to be able to flip that button either to yes, 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 or you're going to have yes, no, yes, no. So you can capture multiple races under this category, which again gives a lot more detail for multiracial participants in the DPP. And then AADE has also added some additional ethnic detail for those who are Hispanic or Latino, where you're able to report whether they are of Cuban descent, Mexican descent, Puerto Rican descent, South or Central American, or other Spanish culture, regardless of race. Education is a new field that CDC has added. It's an indicator for socioeconomic status. Again, that's not kind of a perfect map between those two, but that's one of the reasons this has been added. You are unlikely to have this data in the system already because we were not collecting education level. You might have entered it into a notes field, but it was not in a place that it could be easily converted. So it's likely that education is going to show up as not reported. Now we're going to, stay in that participant chart, and we're going to take a look at payer type and enrollment. So here are the 2 fields that are new: primary payer and enrollment source. So payer is the payer type. So this is the overall category of insurers and payers. So you're going to see things like Medicare, Medicaid, private insurers, self-pay, grant funding. I'm not going to get into the weeds on the data dictionary, but you can take a look at the data dictionary for those remaining options, including other and non-reported. And then enroll is the enrollment source. So this could be non-primary care health provider, primary care provider, and there are many, many more options. Those are also in the data dictionary. And we have like some additional all data fields for you, like insurance carrier. So again, we're still looking at Erin's participant record here. You're seeing the session ID and session type and delivery method now. And this is the changes to session data. So again, what CDC is asking for is for each session to have a reported delivery mode. This can be in-person, online, or distance learning. You cannot report combination for a single session. So you just got to pick one. Hopefully you haven't started your session in person and then continued by phone and then hopped online. You're going to just have to pick one of those. Session ID is kind of numeric coding for the sessions. So for the core sessions, those are numbered sequentially 1 to 26. All core maintenance sessions are 99. All ongoing maintenance sessions, those are any sessions that you're holding after 12 months for that individual participant, are coded 88. And the makeup sessions are coded the same way. Session type is a core maintenance, ongoing maintenance, or makeup. So here are some examples. These would be in different CSV columns, but here I'm giving a session ID of 22. It was my 22nd core session. It's a core session. Oh, someone missed that session. They're coming back for session 22. I'm coding that as a makeup. For the core maintenance, those are both coded as 99. It doesn't matter if they're happening at 6.5 months or at 11.5 months, they're still getting that same number. And again, after that 12 months for that individual participant, those are being coded at 88. So one of the really appealing features of DAPS that we hear from our subscribers all the time is this ability to see real-time analytics. And we're adding this to the participant chart level so that you can kind of keep an eye on how a participant is doing in terms of their core and core maintenance attendance. Also ongoing maintenance if you're engaging with them in months 13 through 24. And it really allows you to see if the participants are making the number of sessions that they need to in order to achieve both CDC recognition and their outcomes. So we know from CDC's perspective, in order to count as sort of a basic eligible participant, they need to attend 3 core sessions. So again, that's a change from 2015. So that's the basic level of eligibility. In order to start to get that preliminary recognition, you're going to need 60% of attendees to attend 9 core sessions and 3 core maintenance sessions. And again, if you pull back the lens, we know as lifestyle coaches and program coordinators that we need to get folks up into the range of having attended 17 sessions, and even better, 23 sessions in order to get the best outcomes. So this allows you to take a look at that participant and make those course corrections if you need to, if you see somebody slipping off track. So for those who had data already in DAPS about participants, we had to do some data conversion. So if the first one is payer, and actually this is one of the questions that's in our pane right now. Our previous question in 2015, is the participant's insurance covering the national DPP as a benefit? And if yes, what coverage? So that was kind of a little fuzzy in terms of the data. You know, let's say we had a participant who was participating. In theory, their insurance could cover national DPP as a benefit, but they were self-paying, or I was covering them through grant funding. So I might have collected that information, even though that wasn't exactly the source of payment for my DPP. CDC is tightening that a lot for 2018, and they're asking who is the primary payer for this participant's participation right now in the lifestyle change program. So let's say they're a Medicare beneficiary, and you know, abstractly Medicare could be paying for their participation, but because you are not set up as a Medicare DPP supplier, they're self-paying, or they're getting grant funding from your you know, community benefit program, or they're participating in a worksite wellness program. So it is going to give who is actually paying, it's going to be asking you who's actually paying for this participant. Because we moved from a fuzzy question to a sharper question, we've defaulted this data to not reported unless there was a really easy mapping between the two. I mean, if somebody was self-pay under the 2015 standards, we've moved them under self-pay. If you said something about grants, we've moved them under grant funding. If you said something about wellness benefits, we've moved that under that valid value. But if you put in data, if you said like, oh, hey, Aetna, Blue Cross Blue Shield of Illinois, we've retained that data on insurance carrier as an additional field. So if Aetna or Blue Cross Blue Shield really was paying for that person, you can go back and edit them into that category of payer. Enrollment is similar. In 2015, we sort of, you know, CDC sort of asked a more open question of like, how did the participant hear about the program? 2018, again, it's gotten a little sharper. Who referred the participant to this lifestyle change program? Again, you can self-refer into the lifestyle change program, even with Medicare. So what we did is we converted to the closest, most reasonable 2018 valid value. If you said something like health fair, then we put community-based organization or community health worker. If you said a mailer, we put media. If you said the Do I Have Prediabetes campaign, we put national media. If you said a diabetes educator, we put non-primary health professional. And we did all of those data conversions to make it easier for you to do that reporting and export that data. Similarly, this is what the sessions look like. So back in 2015, there was just a whole list of dates, and we've now had to assign delivery mode, session ID, and session type. So we've defaulted the delivery mode to whatever the delivery mode is for your organization, what you told us initially. For the vast majority of you, those are in person. But you know, we don't know in a granular way. Like I said, there might have been that big snowstorm and you decided to meet online. So you may have to go back and adjust that delivery mode. It may be a makeup session and we didn't really perceive that within our system. So a call to action for everyone is to go in, take a look at your data, take a look at the data that's been converted, and using the pencil icon, make those edits. So I will show you how to do that next. So again, here's the participant chart. Here's Erin. Here's all of her details. I'm going to select that pencil icon up in the upper right, and voila, I'm going to see my edit pane, and that's going to allow me to make any edits I need. So for instance, education is not reported because there is no way for you to put that information in. But let's say you had a survey of Erin and you collected her education level. You can go back and select the appropriate value for her education. You might see that, you know, it's like, oh, I wasn't able to really select multiple races, but now I can. And so that gives you greater flexibility there as well. Looking at the session data, again, I'm still in the participant record. This is where the pencil icon lives with session data. So you're going to find the pencil icon there. And again, here is where I can edit my session data. You know, this is where you can say, oops, you know, that was actually a makeup session, or, you know, that was delivered through distance learning because we had that big snowstorm. That's where you can make those edits. Or you could go in there and say, like, you know what, all of those were in person, so I just want to make sure that that data got converted correctly. So there are a lot of changes from 2015 to 2018. We've done everything we can to help CDC communicate those changes through DAPS. And so you'll see throughout the platform that there are information icons where you can mouse over the information. It'll give you like helpful information about what's there. So here's an example of one, like, hey, you know, for CDC recognition, only eligible participants are used to determine if weight loss is documented at 80% of sessions. So it could tell you where that analytic is coming from. It could tell you what data is being collected. We also have warnings where it'll say, like, hey, you know, you can continue doing this and you can save this participant's data, but just so you know, they don't meet the CDC requirements, and they're going to be excluded from that CDC DPRP report and from our analytics. And then there are hard stops where there are things that you just simply cannot do in DAPS. Like, for instance, if you select that a participant's sex is male, you then cannot select gestational diabetes as a reason that they're joining the DPP. So just to zero in on some of those warnings. So these are cautions for you. You'll receive a caution if you're entering makeup sessions and you're trying to add multiple makeup sessions within a week. It'll remind you about that and direct you to look at your CDC standards. If you're entering a BMI that's under 25 or 23 for Asian American Pacific Islanders, when you delete something, just, you know, like a lot of websites have this, it'll be like, are you sure you want this to happen? Are you sure you want to delete this? And it'll also warn you if you're trying to enter a participant under the age of 18. For hard stops, we have a number of these too. If you're entering tests that are outside valid values, again, if you're entering GDM for a male participant, if you're entering an age below 65 when you choose Medicare as the payer, we know that there are individuals who are eligible for Medicare under the age of 65, but for Medicare, we're kind of holding everyone to the higher Medicare DPP standards. And again, this question is, who is paying for the DPP? Not necessarily that you have someone who's a Medicare beneficiary. Again, if you're selecting Medicare as payer, we're going to hold you to that blood-based test value, and we're going to kind of force that to be entered. We want to make sure that you're keeping core maintenance and ongoing maintenance in the right lane, so we're not going to let you enter a core session too late or a core maintenance session too early or an ongoing maintenance session too early. And again, everyone is on their own programmatic timeline. So though this is atypical, if you had somebody start 3 weeks early, they are on their, or 3 weeks early, hopefully not, 3 weeks late, they're going to be on their own timeline. And so that just kind of have an awareness of that as you're putting in, as you're putting in those core maintenance and ongoing maintenance sessions. If you try to put in a ton of physical activity minutes, you're going to get a hard stop. If there's a required value and you don't fill it in, that's going to get a hard stop. And then when you're uploading, we're going to stop you if there are not the correct variables in your CSV file. So although we have these, it's kind of like bumper bowling, like we have these protective features of DAPS 2.0, but we really encourage you to get to know the CDC 2018 standards. These are on all of our desks. We refer to them daily, sometimes hourly for our own work, to answer your questions, to respond to emails in the DPP inbox. We've spent the last 4 to 5 months with these standards, looking at them almost every day, and every day there are still things that we have questions about, and we consult our standards. So take a look at those standards, have your lifestyle coaches take a look at those standards, and if you have questions, you can always email us or email CDC at dprpask@cdc.gov. All right, now we're going to move into the analytics. This is another big value of DAPS from our subscribers. You and your lifestyle coaches are out there facilitating the program. You're trying to keep people engaged and retained. You're reviewing their food and fitness logs. You're keeping up with data entry. You're trying to hit that 5% weight loss. So very few people have time to, sit down with Excel and run beautiful pie charts out of their CSV files. So for that reason, we have invested a lot in DAPS analytics so that you can take a look at what's happening on a real-time basis and make those corrections so that you stay on track for preliminary or full recognition. You troubleshoot if a cohort's having some issues. You re-engage participants so that they can stay on track for their attendance and retention and weight loss. So we'll talk a little bit about what we have going on with our analytics. So analytics and reporting, again, you find that under the analytics and reporting tab up at the top. It's pointed to by that orange arrow. And for this, you're going to select the report level. So you can select organization, site, or cohort. You're going to select the report type. So the full report, which is all the data you have ever entered into DAPS ever, or the CDC DPRP report, or coming soon, the Medicare payer report, which is going to look only at participants that have Medicare selected as payer. There's also a date range picker. This is important if you're reporting to CDC. They don't want to see all the data that you've ever entered since the beginning of time. They just want to see that 6-month report. It also helps you if you just want to take a look at the last month or the last year, the last 2 years, to see how a particular site or cohort is doing. So this is what our reporting site looks like. It's just the top of that page. It kind of scrolls on and on. It tells you how many participants are entered, who's currently eligible based on CDC requirements, and how many have been in the program for at least 9 months. So just to kind of zero in on some of the reporting, so this shows the average number of core sessions attended in months 1 through 6, and the average number of core maintenance sessions attended in months 7 through 12. And as you see, there's those little information icons. You can mouse over them, and what will happen is this little black box will pop up that says, hey, for CDC recognition, 60% of participants must attend at least 3 core maintenance sessions. So it links back to those DPRP standards and kind of provides a high-level summary of what those analytics are talking about. Of course, all this new data that you've put in is feeding new analytics, because we want to be able to show you visually exactly what you've spent time entering into DAPS, into the participant record, and into those sessions. So it's going to give you this beautiful chart of the enrollment source. So how are your people getting to your group? Are they finding out through national media or social media? Is it through an employer or employer wellness program? Are they self-referring? Are you getting a lot of referrals from family and friends? It looks like this cohort is getting a lot of referrals from family and friends. Non-primary healthcare providers, primary healthcare providers, so it lets you know what are the drivers to get people into your cohort. Here's the education level. Again, this is what your chart might look like right now, because a lot of you are going to have not reported, because this is not data that we've collected before. But as you start to collect that data and put it into DAPS, this analytic is going to get a lot smarter and be able to tell you the populations that you're serving. Payer is new, so over there we see the category payer breakdown, and that's where you see things like dual eligible, Medicare, Medicaid, employer, other. Again, lots of not reported right now, because we we want to ask you who was really paying for this person before we have that show up on this analytic. But we did carry over all those insurance carriers, so you'll be able to see those. And you see how there's little pop-ups that come up that tells you what that, like, bright pink, it looks pink to me, Medicare is, and what the orange is. You can see those just by mousing over these analytics, and that'll give you additional detail. So here is delivery mode. Again, whole new variable. So once you start to populate this, these are going to start to look really nice for you. So this is what CDC would expect to see if you were an in-person organization. So you're delivering everything in person for your core sessions. You're delivering everything in person for your core maintenance sessions. But where you start to see a little bit of difference is in those makeup sessions, where you have where it's showing that most of your makeups happen in person, but you also have some folks doing makeups online. So this is what CDC would expect to see if you tell CDC that you're an in-person delivery organization. Here's what CDC might see and what you might see if you are delivering through combination. So here we see that, you know, half of people are getting the program online. A quarter are getting it in person, a quarter are getting it through distance learning. And then when you move into the core maintenance session, people are coming back for in-person meetings, and they're engaging online, and you're not doing any more distance learning. So this is what a combination organization would look like. All right, importing. So if you have been holding off on importing your data, wait no more. In no time at all, you will have all of your 2018 data in DAPS. You could do it today, like literally by end of day, you could get all of this done. You just need to go up to input sessions. You go down to import from CSV, and then it's going to take you step by step through what you need to do to import your CSV. So here are some tips to make it easy. You want to, if you haven't been in DAPS and you haven't set up your sites and cohorts, you want to do that first. And then you want to import from your saved CSV file in the current 2018 DPRP format. Now, CDC should have sent you that CSV. So go back, check your inbox, try to find that. But they also have it posted on their website, so you can always go there and get that CSV in exactly the right format. Check your data to make sure that it lines up with the 2018 DPRP Data Dictionary. That's in the DPRP standards. So for instance, you want to make sure your date is in the right format and that you're using those right numbers. Record one cohort per CSV file. Upload each of those cohorts individually, and then once you do, review it to ensure accuracy. If you have additional notes or additional data on participants, you can add that after the fact. Another feature that our subscribers rely on is one-click CDC export. You're going to be reporting even more often to CDC, so we want to make that even easier for you. Again, to get to exporting, you're going to go up to sessions, and then you're going to have three options for exporting: all data, CDC export, or coming soon, the Medicare export. To make this easy, you're going to go to the Sessions tab, select CDC export, use the date picker to select the proper time frame for reporting, click export, save as a CSV file, and you are good to go. If you're exporting for your own use, you just want to pull all of your data and take a look at that. Maybe you have your own data team. They're going to do some really sophisticated analytics for you and regressions and all kinds of things. You can select all data, use the date picker to select the proper time frame, click export, save as a CSV file. And again, that Medicare export of those who have Medicare identified as a payer is coming soon. And that is connected, just for those of you who are excited about Medicare reimbursement, that's connected to those billing codes for Medicare. So it's really helpful in seeing how each participant is kind of ticking off those different billing codes that you can bill for. Another thing that we are happy to provide is technical assistance and support. We know we really value our subscribers, and we are here to support you technologically, programmatically, as you're working with DAPS and supporting your lifestyle coach programs. So if you need additional help, we had this webinar today. It's going to be recorded. You're going to get the slides. But we have another webinar just like this next week, the 26th of July at 11 Central Time. We're also doing Technical Assistance Fridays, and we have appointments still available. So you can sign up for 30 minutes and you can talk with us kind of, with our team, and we can troubleshoot any issues that you're having. We can kind of walk you through step by step what you need to do to get your data uploaded and exported and edited and reviewed. The 20th of July, we're giving priority to July reporters. 27th of July, we're giving priority to July and August reporters. And then we have 3 more dates coming up in August, the 3rd, the 10th, and the 24th. We have free monthly DAPS demos, so tell others. If you like DAPS, tell others about it, and we're happy to let them know how the program works. You're also welcome to drop into those DAPS demos and ask your questions. And of course, you can email us at dpp@aadenet.org at any time. DAPS is just one part of AADE's work to support the expansion of the national DPP. We do public and private lifestyle coach trainings here in Chicago, across the country. We do Building Your DPP workshops. We do workforce training that focuses on those advanced lifestyle coach skills. We do presentations on the CDC standards and Medicare DPP reimbursement, and many other things. We're not just kind of here in our office supporting these and talking to people on the phone. We're actually out there actively working with CDC and working with partners to engage more people in the national DPP. One of the groups that we are working with right now that I just wanted to tell you all about in case you have any contact with truckers is we are actively right now recruiting over-the-road and long-haul truckers and others with CDL. So if your site does, certified medical exams for the Department of Transportation, and you have these folks and they're not quite ready to join your cohort because they're out on the road for weeks at a time, definitely talk to us, because we have this resource available thanks to funding from the Centers for Disease Control and Prevention and our cooperative agreement. We can enroll these folks in a virtual DPP, fully recognized by CDC, give them all of the support that they need. Maybe they can drop into your group as well and get that added benefit. But let us know if you are working with truckers. We would love to help. All right, so we are going to take a look at our chat panel, and I'm going to also open this up to the team who's here with me so that we can see if we can answer a few of your questions here today. So the first question is, can you confirm modes available for makeup classes under the in-person mode? So yes, there is no limitation for how you want to deliver your makeup classes. You know, you could be an online organization and you can deliver makeup classes in person, you know, or you could be an in-person organization and deliver makeup classes online and through distance learning. So the only thing that's not an option is combination. Again, when you're talking about an individual session, combination is just not available to you. Okay, next question. What if we aren't billing for our program and don't collect payer data? I have currently been reporting as other. So, you know, CDC is eager to start collecting this data because they recognize that there's a lot of grant funding out there right now, but we want to start building more sustainable ways of paying for diabetes prevention programming. A really great historic payer has come on board with Medicare, and it helps CDC to be able to look at all of their data from all their 1,700 some sites to be able to say, like, well, right now we have 3/4 of folks who are receiving grant funding, but over the next 5 years, we'd like to see more and more of those individuals have a payer. So just something to think about. You do want to try to collect all of these fields so that you can report them to CDC. And I think that they recognize that it's going to take time to collect that data and then to get it inputted. But as you start to think about collecting that data from your participants, that's a question that you can add. What delivery mode should we use for makeup classes if it's in a different mode than our normal classes? Our code is for in-person, but we offer makeup by phone. Yeah, so the great thing about the coding is that you sort of can code these separately. So you would be, hold on, I'm flipping through my presentation. So if you, let's say you were doing a makeup for core maintenance, so you would say, okay, well, this is 99 because it's a core maintenance session. I'm going to tell you the session type is a makeup, and I'm going to tell you the delivery mode is distance learning. So each of those are separate variables, and so you would be able to do that separately. Can you give an example of when we would want to import data into DAPS? I'm not too clear on this part. That is a great question. That's really just when you're getting started with DAPS. If you've just subscribed to DAPS and you're like, wow, you know, I've been out here tracking things on my CSV file, and now I have this whole system that can support me, that's when you would import data into DAPS. Or let's say you merged with another organization and they've been doing a cohort and you want to now set them up as, you know, like one of your cohorts, you could import them then. For most of you who already have your data in DAPS, you're not going to be importing data, you're just going to be editing your data within the system. Okay, on slide 31. DAPS gives an average of how many core maintenance sessions everyone attended. However, the standard to meet is not average, rather it's to have 60% attend 3 core maintenance sessions. Where in DAPS is this calculation so you don't have to manually count? I believe that's on the analytics page, but we can take a look at that and we can get back to you. So why would we be collecting data beyond the 12-month period for an individual? I thought the CDC just required data for 1 year. That is true. This is a 1-year program, but Medicare offers the opportunity for participants to continue in the program through ongoing maintenance and to bill Medicare for participation for those ongoing maintenance sessions that happen between months 13 and 24. And we do know that there are some sites out there that have reunion meetings and, you know, bring people back in those 13 to 24 months. CDC is, you know, not really going to take account of that data when they're making determinations for preliminary and full recognition, but the capacity to track that data is in the system. So when you do that export for all data, that'll show up. When you do that CDC export, that's not something CDC is going to be looking at. So good question. All right, I think that's all the questions that we had in our chat panel right now. Let me just move the chat panel out of the way. I'll do one more check before we say goodbye. All right. You may experience some unexpected features as you're going through DAPS. This is, you know, it's technology. So if you experience any issues while using DAPS, we're here to help. A lot of times we can troubleshoot that with you, and it's a very, very simple fix. But we're also, if you see something really unexpected, we can escalate issues to our IT team and developers. So take a screenshot, make sure there's no EPHI, PII on there, and send it our way, and we can take a look at what's going on for you and try to resolve it or escalate it to our developers so that we can handle any of those features that we did not plan. This is our contact information. Again, we are the DPP team at AADE. This is our email. We all are looking in this inbox, so it's always monitored, and you can give us a call. Please contact us. We are really happy to help. And definitely sign up for one of those technical assistance Fridays. If there were members of your team that didn't make it to today's webinar, you can share the slides, share the recording, and we're also doing another webinar next week that you're welcome to sign up for. And I don't see any additional questions. But again, if you have one the minute I end this webinar, you can always email it to us at dpp@aadenet.org. Thank you so much for joining us today, and we look forward to working with you and helping you have a successful and sustainable diabetes prevention program. Thank you so much.